Welcome to Healthcare Radius Leadership Vidcast. Today we have with us Ms. Zahabiya Khorakiwala, the Managing Director of Wockhardt Hospitals, a chain of modern multi-speciality hospitals. Ms. Zahabiya started her journey with Wockhardt Hospitals as Director Business Development in 2007 and assumed the mantle of Managing Director in 2010. Under her leadership, Wockhardt Hospitals with 5 super specialty hospitals has emerged as country's leading patient-centric healthcare destination. Ms. Zahabiya has augmented Wockhardt Hospitals' portfolio by setting up 2 new hospitals in Mumbai. The modern quaternary care South Mumbai hospital that she built from scratch received JCI accreditation within first 3 years of its operation. Ms. Zahabiya has instituted an advanced multidisciplinary regenerative medicine business, the newest venture of Wockhardt Group. This research presents immense therapeutic potential in wound healing, osteoarthritic pain alleviation, anti-aging effects, and the treatment of alopecia. Ms. Zahabiya has also set up Wockhardt Global School, a K-12 school in Aurangabad, Maharashtra, that offers international degree and CBSE programs. This young healthcare leader has been recognized as among India's 40 under 40 emerging business leaders and one of corporate India's fastest rising women leaders by Economic Times. She was also conferred with Young Business Women Leader Award by Lions Club International and the Women's Leadership in Healthcare Award by ABP News. Ms. Zahabiya, we welcome you to today's vidcast, and I want to start the session by asking you a little about the journey so far. Wockhardt Hospital is completing 25 years this year, so looking back, what come to your mind as the top 3 achievements of the hospital that you are proud of as a business leader?
So let me kind of go back to, we've been in the business for now almost 25 years. We really started off with a single hospital in Calcutta and Bangalore, a kidney hospital and a heart hospital. And then that was for about a decade, and then the next decade was, where we kind of expanded that presence with larger facilities in the metros. And I think one of the things, and then of course the divestment happened with Fortis in 2009-10, around that time. But I think one of the things that we really did uniquely is we were probably one of the first corporate hospitals, or maybe the first one, to realize that healthcare in the tier 2 cities and the tier 3 cities, from the kind of quality that corporate hospitals and larger multi-speciality chains offer, that kind of healthcare was absent. Patients were really traveling from these markets to the metros, even for things like an angioplasty, a cardiac surgery, a knee replacement, neurosurgery, etc. And that's when we really identified a business model which we were able to realize back in 2004-06. That is when we set up our first tier 2 city hospitals. That was almost 15-20 years ago.
This was in which city?
So we started with Nagpur.
Okay.
That was the first heart hospital. Then quickly we had another hospital in Rajkot. So these are facilities that have been there for almost 15 years now, 20 years now. They're markets that, and interestingly what has happened is obviously other people have followed. But as a result of, Wockhardt coming into these markets, we have been able, and we are obviously in the tertiary care space. So we're able to offer very high-end work. So that need, which was not being met in the market, that got met. But also the other facilities operating in the market of or secondary care or whatever level, they've also been they've had to kind of raise their standard of care as well. So the care of the market as a whole has benefited because everyone has had to raise their standard, and so the quality of care for patients in these markets, in these regions, has significantly improved.
Run us through the experience of setting up the Mumbai Central Hospital, because that's the one that you built from scratch. What has been the journey of that particular facility so far, and overall, how do you see as the Mumbai's most happening urban center, where your hospital is located? In fact, there was no other private hospital at that time.
When we divested to Fortis 2009-10, what we had was our tier 2 facilities for a group to really kind of stay contemporary, have the latest level of medicine being practiced, technology, clinical talent, all of that. It's very important to have a metro presence because the metro really provides you that opportunity to invest in those kind of things. So that's when we actually launched 2 hospitals. One was the South Bombay facility, which is a 350 bed facility, state of the art, etc. And at the same time, 2014, we launched also our Meera Road facility in North Bombay, again 350 beds. So that year was actually a year where we kind of really established a strong presence in Bombay with a hospital in the south as well as one in the north. And it was important for us to do that as a group because it keeps us very kind of relevant, contemporary, ahead of, able to invest in the latest things. And I think setting up that hospital and kind of what we've done today, it's a competitive market. We've been in a market, unlike our tier 2 cities where we were one of the first corporate hospitals to be there, South Bombay, we are in a competitive market. Our strategy to kind of set that up was to stay really true to our core, which is that we've always had full-time consultants, establish and drive the practice of the hospital. South Bombay as a market has always worked as a visiting consultant model where doctors practice in various facilities. But keeping the geographical nuance in mind, we basically got on board clinicians who were full-timers. And we also empaneled a lot of visiting consultants because whilst it takes a little longer time for organically new doctors in a new city to establish practice, for us to be able to establish them over a period of time was going to take time. We were able to bring in the visiting consultants to bring their practice in and to get the hospital, at least kicked off with volumes, etc. So today our South Bombay facility actually is a very healthy mix. Almost 50-60% of our work comes from our full-timers. The balance comes from our visiting consultants. I think one of the very, I would say, satisfying aspects of this hospital is that all the full-timers that we've got have been new to the city of Bombay. So they have entered the market for the first time. We've got them from abroad or from another hospital, another region. They're young talent. They've all kind of established themselves. We're at a point where now we've added another second line of consultants to 3 consultants in every specialty because we've been able to grow them in a very competitive market scenario. So I think it's been for me personally, a journey of learning from really brick and mortar, physically constructing a hospital to really kind of seeing it profitable and what it takes to kind of go through that. It's had its ups and downs, but it's been a very interesting journey.
Just want to understand, does your Mumbai Central facility become a POC kind of a thing where you will deploy your technology first over there, test it there, and maybe expand to other facilities?
I won't call it a POC, but what I will say is that it's the most ready facility to take anything new because the demand for that is there, right? So you bring in something where there's a demand. If there's no demand or there's no affordability, you can't bring it in. So we have the ability to do that at South Bombay and obviously gain some learning from that. And then if we're able to say, okay, this also would work in somewhere else, then we're able to take it. But yeah, that's what it is.
Talking about the tier 2, tier 3 opportunity, I would say then you were, one of the early adopters of this strategy. What has been your experience about these markets? How different are they from the urban centers that you also operate in? And what kind of, models do you operate over here? These are all partnership based, or you went and, built that as greenfield projects from scratch? How did you go about?
So fundamentally, the business models here are partnership models where we've identified hospitals which have been operating in the market for some time. They're usually trust hospitals or philanthropic or, hospitals where, say, a business leader has started a hospital out of some philanthropic intent. But running a hospital is not an easy thing. It requires a lot of It requires identification and recruitment of the right clinical talent as the first important element, and then constant investment upgradation. So these facilities have been facilities that have sort of been not doing so well over the last few years, and they've been looking to partner with somebody who will come in and bring that expertise. So those are the kind of arrangements we've done. We've not gone ahead and built our own facility from scratch. That has done two things for us. I think it has enabled us to be competitive in the market from a pricing perspective. We've really been able to make our facilities affordable. It's important to know that in the tier 2 markets, 50% of our business today comes from the city itself. So for example, Rajkot, 50% will come from Rajkot, but another 50% drains from the peripheries of Rajkot, right? Jamnagar, Junagadh, all of that. So, these business models, these hospitals have to be rightly priced. And I think this business model where we've kind of moved into an existing facility has worked well from speed of entry as well as from the investments that we've had to make. So what we've brought to these hospitals fundamentally is the technology upgrade, right? So that is the expertise, that's the investment we've brought in, but at least the shell, the building, more or less the functioning of the hospital has been.
So what are the challenges when you look at, running a hospital in an urban center vis-a-vis in a tier 2 location? What do you see as challenges in terms of, manpower acquisition, technology upgradation, probably some kind of patient awareness programs? What are the different challenges that you experience?
So, frankly speaking, you enter any market in the country, each one is unique.
Yeah.
You enter Saurashtra, Gujarat, it's different. You enter Nagpur, it's different. You enter a Bombay, it's different, right? So every geography has its own unique demographics, its own clinical culture that prevails in that market, and therefore it's very important for you to be able to spend some time to understand those business nuances and adapt to that. I think for us, entering into some of this tier 2, the more broader kind of things we had to look at differently was training of talent, right? So I think for Wockhardt, as our strength, we've always been able to acquire high quality doctors. The brand has had holds a very good equity in the clinical fraternity. So even most of our clinicians that we got for the tier 2 cities were not necessarily doctors who existed in the market. These are clinicians that were practicing maybe in a metro or abroad somewhere, and we were able to identify the talent, bring them into the city. It could have been their hometown, or it presents a unique opportunity for a young talent to establish a big practice in a smaller city. So acquiring clinical talent, I would say, has been our strength. But as far as, the nursing, the allied services, there it does require a fair amount of training. So the back-end infrastructure, soft infrastructure of the hospital to be able to train, to have that kind of rigor is very important to be able to deliver the complete mile of care.
So when you spoke about nurses and the secondary staff, do you see that, especially nurses or, specialized nurses like onco nurses and all, do you see that as a challenge in terms of acquisition and is continued medical education the way forward? What's your comment on the shortage of nurses in urban as well as rural centers in India?
So, I think the shortage is there. There's no running away from the shortage. The challenge or the challenge before all of us really is to ensure that the quality of care is maintained, right? So there is a shortage, there is attrition, but how are you able to still maintain the same standard of care despite these externalities which we can't overcome? I think what we've done is we've had a relationship actually with Harvard Medical International for a long time, almost 20 years. And one of the key pillars of that relationship in the early years was a focus on nursing. And we, through collaboration with them, we've built a nursing leadership program within the group. We identify nurses of a certain level of talent, not just from a nursing care, but also from a managerial leadership perspective. And then they're groomed through a process, they're selected, they're groomed. So these are the ways to empower nursing, but also to make them sticky and show them, growth within the organization. frankly, a lot of our nurses, most of our nurses get, the attrition we face is where they get recruited abroad to the other markets, not within India so much, but abroad. But I think that's a reality we have to live with. We also do a lot of sponsorship for our nurses who want to do a higher level of education. So a GNM nurse wants to become a BSc nurse, so we kind of look at that. So these are strategies to kind of make the quality of nursing provided at a certain level, but also improve the stickiness to the organization. And then, of course, you have specialty nurses, a diabetes nurse who is specialized for diabetes. She will shadow the endocrinologist because today the nursing has an opportunity to partner directly in the patient care and influence those outcomes, compliances, etc. So you kind of have to get nursing more involved in the care of the patient. It is not just a consultant or a clinician who episodically will treat the patient and then that's it. There is a much greater opportunity of involvement for a nurse. So our nurses, after discharge, will give a care call to the patient, check how they're doing, on day 5, on day 2, on day 14, make sure they come back for their follow-up. Do they have any pain? Do they understand the medication that is being, So all these kind of things really improve the quality of care you're able to impart, not just within the hospital, but even when the patient goes home.
You spoke about affordability, accessibility. These are some of the concerns that you had, when you started out in the rural areas. How did you tide over these, challenges? And as a part of, this strategy, did you also engage with any government programs, its PPP model or any of these?
Like I said, every geography is different. So in some of the geographies in the Tier 2 cities that we operate, you have to kind of enroll in the government programs that are there because it is so widely penetrated in the market. So if you do not ascribe to it, basically you don't have a presence in that specialty. But I think what we've done well is that we're part of some of these programs and we've been able to manage our resources, our cost structures such that we're able to kind of make it viable in itself. So I think, accessibility to healthcare really comes for private healthcare today from the schemes, whether it is a CGHS scheme, Prime Minister's Ayushman scheme. The states have their own schemes. So these are the ways where, healthcare is able to kind of penetrate into these markets.
Okay, as an industry leader, what is your assessment of the government's vision and even actions when it comes to healthcare policies and boost to healthcare sector in India today? And what are your expectations? What more do you want the government to do going forward?
I think it's important for us to know that the Indian healthcare hospitals and the Indian healthcare industry today offers a very high quality of care at a fraction of a cost, as it is, right? And the quality really comes from the fact that we are in a very populous country. So our doctors are extremely well trained. The kind of volumes of patients they see, the range of cases they see is unique, right? And I think that's why they get so good at what they're doing. And I think the fact that because we are in a country like India, even in a private healthcare setting, the costs of private healthcare are a fraction to the value that we offer, the qualitative value. Having said that, I think the government is extremely ambitious in terms of, and well-intended in terms of really healthcare getting more accessible to the larger population. The Ayushman scheme is one such kind of initiative that they've aggressively rolled out. The second important one, which I think will be quite game-changing and in a very positive way for the country, is the ABDM, which is the Ayushman Bharat Digital Health Mission, right? To kind of get the clinical health records, integrated, available for all the patients, integrated to the healthcare systems, etc. I think that is definitely going to be changing the fundamental infrastructure of Indian healthcare. But I think we also need to recognize that our current cost structures and the way that the industry has functioned has always been at a affordable level, because India is fundamentally a out-of-pocket model. Patients pay for their healthcare. Insurance penetration, still a large section of patients are paying from their pocket. And therefore, by that market dynamic itself, the price of healthcare has always been such that a patient can pay. Right? So we don't have healthcare pricing today which is excessive, because because the market will correct for itself. We are only pricing it at a level where the demand is there to be able to afford it.
Correct.
Right? So I think we function today at a very affordable level of healthcare, and we also have within the private sector there are the complete range of facilities you have. You may have the very kind of top end infrastructures which have international accreditations like JCI, etc. You also have now NABH as the quality, Indian quality standard, which a lot of hospitals. You have nursing homes. You have a wide range of private healthcare facilities for every level of affordability. So I don't think that we are priced in a way which is unaffordable, even as the private sector. And I think private sector, at the same time, I think there has to be an understanding that for the Indian healthcare industry to flourish and keep flourishing, innovation must also come in terms of technology, in terms of, and all of this can only come in if, the market is left to function as an open market and not as a controlled industry.
Yeah, you spoke about 2-3 things, in fact, that were interesting. One is you spoke about the expertise of the doctors because of the number of volume of patients that they have handled. Secondly, you also spoke about the market will do the correction. So as a result, pricing is also a sweet spot at the moment. So does that give you an opportunity for medical tourism? Are you aggressively going after it, and what is your strategy around that?
Yeah. So medical tourism, frankly, I think India is still at early stage. The world has not recognized us fully in terms of the quality of healthcare and the infrastructure, the talent that we have for this kind of industry to develop. So it is still kind of, some hospitals are doing their share. We, for example, drain a lot of patients from Africa, from the Middle East. Now even from the Western markets like the UK, where NHS has very long lead times for patients for elective procedures. So South Bombay Hospital actually almost 20% of our patients today are international patients. And the opportunity is tremendous. I think that is also an opportunity for the government to really look at how to make India more attractive for medical value travel, because we have everything to kind of offer high quality outcomes.
You also spoke about innovation. Going forward, innovation will be the key. In fact, I remember a few days ago you invested in the Mako robotic surgical equipment. So what is your plan going forward in terms of digitalization, artificial intelligence, all the technology stack? Which are the areas that you are bullish about, and what are the investments that you are going to make going forward? What's the budget?
So my basic approach to innovation, technology, etc. Is really identifying where the technology is going to give the maximum value today, right? And I think you have to identify technologies which are giving you the value today so that you keep kind of having the appetite to do more. So for example, the Mako robotic, the orthopedic robot, the reason we kind of selected the Mako one, we were the first hospital to have a Mako robot in South Bombay. There were other robots installed by other facilities, is because I think even though the Mako robot, so Mako we know is a global leader in robotics, but they have not been able to penetrate the Indian market very successfully, for various reasons. And I think our selection for the Mako robot was fundamentally that it is a superior technology which will enhance clinical outcome to the patient. There are 2-3 features that really make it stand out. One is that it is a CT guided robot, right? So you take a CT of your knee or your hip, whichever joint you're doing, and based on that, the robot is configuring the cuts and the slices that the doctor has to do. Most other robots don't do that. You're just going in cold, right? So there is no pre-planning of the surgery itself. The second is that there is a safety feature in the Mako robot which no other robot has. Right? It's got a haptic technology, which means that if the surgeon is actually trying to cut more than the demarcated line, there's a counter pressure where the robot will not let you do that. So that gives a lot of comfort to a surgeon and secondly, the Mako robot, the surgeon is holding the thing. It is not the surgeon sitting and the robot is just doing the surgery. So actually the surgery is in the hands of the surgeon, not completely tech driven. And so the precision of the surgery itself is extremely high. So for us, technology is not a marketing tool, right? You don't buy a robot because I just need to market it for 3 months and then forget about the actual value. It has to be actually valuable to the patient. Only then will the surgeon buy into it, and only then can you influence patient outcomes. So that's the way we've kind of always looked at technology as far as the digital space is concerned. We're looking very carefully at areas of bringing digitalization which influences and impacts the business. So we're kind of looking at it from a customer perspective first, rather than a process perspective. So, areas where we can improve patient experience, or, just communication with patients. So multiple things we're doing, all too much detail for me to get into. But over the last 2 years, we've really kind of undertaken this transformation journey on the digital spectrum, which will actually change the way a patient experiences a Wockhardt hospital from what they used to before.
So you spoke about robotics at length. Are you also looking at technologies like telemedicine or artificial intelligence to bring efficiency and improve the accessibility?
I think a lot of this technology, you have to be careful how you decide to look at it, right? And implement it, because sometimes a lot of it can be waste.
Yes.
You kind of, it's fancy, it's sexy to do now, but the fact is, where is it really going to bring in the value? So you have to really identify your needs very accurately, your problem statements which you want to solve, and then identify technologies which will solve for those problem statements. So AI is built into a lot of the tech that we're doing, but it's not for the sake of doing something to do with AI. So for example, a call center, there are so many areas where you can improve efficiencies, because you can't always add. Otherwise, you're dependent as you expand of always having manpower to kind of account for that growth. Now, technology can take over a large part of that, where you only have the very critical elements handled by people.
Any expansion plans going forward now that it's 25 years? Are you looking at opening new centers, entering new markets?
Those things would be opportunistic as and when if they come along. We have a large we still have about 40-50% of our capacity that we can utilize. So we can double our growth from where we are today. So opportunities come along in the geographies that we are present to strengthen our leadership position, strengthen our, we would look at it.
So currently you are, in the Western India belt. Are you looking at other regions as well, South, North, East?
So, we've never looked at size as a way to benchmark for how good we are, right? Size is one way to look at it. It depends where you are in the journey also, maybe. But for us, it's always been the quality of work we do, the kind of leadership position we hold in the markets that we're there. So if there are opportunities that will strengthen our position in the existing markets, that is something we would look at. We would not be keen for the sake of expansion to enter a different territory or a geography.
IPO plans anytime soon?
No time.
Last question is about, work-life balance. Are you able to give time to your children, to your family? How do you manage that? And in fact, doctors, I would say, also are so workaholic that probably they also may be finding this as a challenge. So, closing this, what will be your message to doctors as well? First yourself and then now the doctors.
Frankly, working with doctors very closely, observing them very closely, I have to say that they are, at least in my view, the hardest working professionals I have seen. They get no downtime, no time off. They are constantly on call, on the move. So I don't work as hard as a doctor, I'll say that up front. They are the hardest working by far. What I do, I think for myself, my work is my priority and my family is my priority. My weekends are very sacred. I don't work on the weekends. And if I have to, it's completely for my family, for my children. So I don't have any social commitments on the weekends that don't include my children. Meal times, dinner time is something that I'm always there. I will rarely miss dinner time, bedtime. I think you have to figure out certain things that are important to keep a rhythm for the children where you are present. I don't miss any of their important school things, whether it's report card or annual day or whatever. I make sure I'm there. So those are things that I make sure that I kind of always, work doesn't come into that. Other than that, I think for children, for my girls also, I think it's good to see their mother work or do something. I think it also has element of where they have an opportunity to see you as a role model for their own lives and their own future. So I think there's a way to kind of see the good in both
What's
sides.
your message, work-life balance message to medical practitioners who work in your hospital and hospitals elsewhere as well?
I think you don't need to balance it out if you love what you do. I think you figure out the harmony of your personal life and your working life. If you're enjoying what you're doing, it comes pretty naturally. You don't have to stress about how to balance it too much. You'll figure it out. As long as you love your family and you love your work, you'll make it happen.
Thanks a lot
Pleasure.
for joining us on Healthcare Radius Vidcast today.